Doctors, what is the most stupid thing a patient has said trying to correct you? Me. Sir, I need to know why you stopped taking your antiretrovirals for your HIV. Him. Well, I met this witch online that. Me. Wait, did you just say witch? Him. Yeah, she sent me a bunch of herbs every month to cure my HIV, and they worked. Last time I checked, I was cured. Me. Where and what tests did you do to know you were cured? Him. I did an online test that the witch told me to do. There were a lot of random questions, but in the end, it said that I was free of HIV. Me. Okay, we'll need to do a blood test to confirm that. Now, can you tell me which herbs you were consuming? Him. I don't know the name, but I have them right here. Points at his backpack. Me. Would you mind if I take a look? Him. Sure. And I opened the bag, and what I saw was nothing but oregano with something that smelled like chlorine. The patient, sadly, passed away from a severe sepsis a month later with a highly resistant microorganism, just because a witch on a website told him to stop taking his meds. Hold on, why did he go to a witch for healing? That's a cleric's job, you know? Sorry to hear about the guy, though. Story 2. A mother brought her daughter to the ER due to hypogastric pain and spotting. We asked the daughter about her last period. She said about 2 months ago. We asked her for her history, thinking this might be an ectopic pregnancy. The mother kept butting in, saying that she is still a V and she has no boyfriend. We left it at that until her mother went out to go to the bathroom. The patient admitted that she did it with a classmate of hers. We requested a pregnancy test and other tests, and it really looks like an ectopic pregnancy. We advised the mother that her daughter needs immediate surgical intervention. She refused to believe us, saying that the lab results are unreliable and untrue. She keeps on saying that her daughter is a V. She stormed out of the ER with her daughter that looked really in pain. Story 3. I had a patient once with family members who were some of the most frustrating people I've ever dealt with. The patient was obese and had open wounds. Cleaning her when she was first admitted was like some sort of disgusting clown car. We found a floral pillowcase shoved under one fold and what we think was a smashed bread crust in another fold. Anyway, because of her weight, she wasn't a candidate for surgery and therefore there was nothing our team could do for her. I think about 5 or 6 different meetings were held with her family to discuss her prognosis. Her daughter told the attending physician he didn't know what he was talking about and that she had been this sick before and pulled through. Her pH was so low it just read as less than 6.8, and her blood pressure was a solid 60/25 despite every vasopressor under the sun running at 3 times the max doses. When the charge nurse pointed out her blood pressure on the monitor, the daughter said, "Psh, I've seen lower." When she finally passed away, her family was livid that we didn't save her. We coded her for 20 minutes and they told us we should have continued for at least an hour. I felt terrible that her last days were spent in such torture, all because her family was in such denial about her condition. Story 4. I work in a burn ICU, which is a unique and specialized area of medicine. It can be really frustrating when patients and their visitors come in thinking they know everything about burn treatment. People often think that mayonnaise, mustard, and butter are good for treating burns, but they're not. These condiments should stay in the fridge. It's not fun having to scrub off 3 jars of mayo from someone's grandmother. I had a very sick patient with large burns and a serious lung condition called ARDS, which makes it hard for them to get enough oxygen even with the ventilator set up to the highest settings and continuous medication to help their lungs open up. This patient was placed in a special rotating bed that we secure them into and we rotate them. They were also on continuous dialysis because their kidneys suddenly failed. This patient was extremely ill with 10 to 12 IV bags all going at once. It was a total mess. Then there was a family member who claimed to have medical experience. These are the worst kinds of people. They usually turn out to be someone like a medical transcriptionist or a nursing assistant at a nursing home, but they love to come in and try to take over. Here are some highlights from the medical expert before I had to ask her to leave the unit. She yelled, "Why aren't you paying attention to his brainwaves?" She was pointing at the ventilator display, which has everything to do with breathing and nothing to do with the brain. She also yelled, "Why isn't he on proprapanol? It's negligent to not have him on proprapanol." She meant propofol, the medicine made famous by Michael Jackson's case, but the patient was already on ketamine and Versed, which were already working well for him. Propofol had caused some unwanted effects earlier. She also demanded, The dressings are dirty and you need to change them immediately. But changing a full body dressing while the patient is in a rotating bed takes at least an hour. And this patient was so sick that moving him from face down to face up could have caused the fluid to shift and possibly end him. Also, burn dressings can get gross quickly, but that's just how it is. I was really irritated by the time I asked her to leave. I've never had her do that with anyone else, but she was incredibly annoying. Story 5. There was a woman with cancer who came into the hospital for a procedure to insert a chest tube and drain fluid from around her lungs, which we thought might be caused by the cancer. After the procedure, I went home and the resident doctor who was on call had to deal with lots of calls from the upset nurses on her floor. The next morning, the resident, who looked really tired and had red eyes from a busy night, told me that the woman was now my responsibility. Then he went home to get some rest. When I went to check on her, the nurses told me she had refused all pain medication right after the surgery, even though the tube was touching her lining, which must have been very painful. I went to talk to her and she told me, even though she worked in the medical field, that the tube had been pushed in too far and was hurting her. She wanted me to undo the stitches and pull the tube out a bit. I couldn't do that because I wasn't allowed to. The x-ray showed that everything was fine and no changes were needed. I explained to her that she needed to take her pain medication if she wanted to feel better, but she seriously told me that pain meds will make the cancer spread more, and that I should know that as a medical student. She even said, "Don't tell anyone, you're a doctor, use your own judgment and pull the tube out." She was very stubborn. My professor was going to be late that day, and I definitely wasn't going to do anything without his signal. I wrote down that she refused treatment and went on with my day. She left the hospital that afternoon against the doctor's advice. I feel bad for her because she wouldn't let me help her, but there wasn't much I could do. Story 6. When I was in high school, I went to the hospital because I had a sharp pain on the lower right side of my stomach. It felt pretty serious, so both of my parents came with me, which was unusual because they're divorced. A doctor looked at my symptoms and said it looked like I had appendicitis. I groaned and said, "I don't have an appendix. It was taken out when I was younger." But my parents said, "Yes, you do. You have an appendix." When I was a child, I had surgery to fix a problem. My parents told people that I had my appendix taken out to explain why I was in the hospital. I believed this for many years, so when I learned where the appendix is located in the body, I thought they must have done a special kind of surgery to explain the scar there. I was really surprised to find out that I actually do have an appendix. The pain I was feeling turned out to be from a piece of chicken bone. It was a relief to know that it wasn't something more serious like appendicitis, but it was also a bit embarrassing to realize I had been wrong about not having an appendix for so many years. Story 7. My wife is a doctor and I'm a doctor too. One day, a female patient came to see her because she was having trouble getting pregnant. The patient said she and her partner had been trying to have a baby for about 5 years and had, quote, tried everything. At one point, she accidentally used the pronoun she and I, which made my wife say, "Wait, let's go back a minute." It turned out that the woman had been in a relationship for a few years and never got pregnant, even though they didn't use any protection. Then she started a same-gender relationship and still didn't get pregnant, even though she really wanted to, which made her think she was infertile. When my wife tried to explain that to have a baby, you need something from a man as well as an egg from a woman, the patient was shocked and said she didn't need a man in my life and didn't like being judged. It seems like the patient didn't understand the basic biology of conception. In the end, the patient didn't come back for more appointments. Story 8. I'm a registered dietitian and nutritionist. I was helping a patient who was very overweight, had diabetes, and had serious nerve damage in his legs and feet. He was also a chiropractor who really liked using homeopathic treatments. Every time I tried to give him advice, he would interrupt me and say that some kind of homeopathic remedy would work just as well. It was really frustrating. Finally, I just told him straight out, "Listen, doctor, you need to stop eating so much sugar and make sure you eat vegetables with every meal. You can still drink your homeopathic remedies if you want, but all those years of drinking special water have brought you here to my office with a damaged pancreas and no feeling in your feet. We need to take this seriously unless you want to risk a medical emergency or stroke by relying on your flower remedies." After that, he got very upset and complained to our hospital's patient relations department. I was told to go to a training session where they said I should have listened to his ideas about his health and made him feel like I was taking him seriously. Some people who weren't doctors or nurses told me that since he was a chiropractor, I should have paid more attention to his opinions because he was a licensed healthcare provider. I finished the training, but I started looking for a new job right away. Story 9. I'm a medical student and my mom is a nurse, but this story is about my grandmother. My grandfather is in his 80s and just had his second back surgery. My grandmother, who is in her 70s, is the only one taking care of him. She thinks she knows everything about medicine. After my grandfather's first back surgery, which happened not long after a knee surgery, my mom flew to their home to help him for the first few weeks of his recovery. He needed a lot of help with physical therapy and had to go to the doctor's office about an hour away, so having someone younger and experienced was really important. But my grandmother didn't agree. My grandfather takes about 8 to 10 medications every day, and my mom knows a lot about all of them, but my grandmother wouldn't let her touch his medicines, give them to him, or remind him when it was time for his next intake. She wouldn't let my mom help him out of his chair, bed, or to the bathroom and shower. She couldn't help with his physical therapy, make him food, or clean his stitches. My mom felt like she was a child again. And why did her mother act this way? Well, my mom took 6 years to get her nursing degree, so my grandmother thinks she's not a good nurse. It doesn't matter that my mom has been working as a nurse for 25 years, is the top nursing expert at her job, and is currently in another nursing program to learn about new medical advancements. My grandmother is older and has been dealing with her husband's health for a long time, so she thinks she's the only one who knows what's best for him. She even told me that going to physical therapy is a waste of money because she never needed it, so why would anyone else? Well, that sounds more like they don't want to accept that they're getting older and need help. Plus, the grandmother just sounds very controlling. Can't win with that. Story 10. I can tell you about 2 different situations, both involving family members or friends of the patients. The first one was about a patient who had a straightforward surgery to fuse 2 bones in his spine, specifically from L4 to S1. After the surgery, he did really well and went home. However, his daughter, who was into alternative medicine, gave him a treatment that was supposed to be good for his health, but it actually caused bacteria to get into his surgical wound. 3 weeks later, we had to take him back to the operating room in an emergency to remove the metal parts that had been put in during the surgery. He ended up spending 6 weeks in the hospital, all because of the alternative treatment his daughter gave him. The second situation was about a man who practiced natural medicine and was brought into our emergency department. At first, he wasn't responding, but then he woke up. Despite the seriousness of his situation, he insisted that we try some alternative treatment to reduce the symptoms and let his body heal naturally, instead of going straight to surgery. His friend, who also practices natural medicine, came in to do something while we were taking care of another patient. When I tried to explain to him how serious his condition was, he stopped responding again just 2 minutes after I left his room in the emergency department. Because of his condition, we had to make a quick decision and take him to the operating room to fix a problem. Unfortunately, he didn't survive, but his organs were donated and ended up saving 5 lives. So, in a way, he became known as the natural medicine practitioner who saved lives, but just not in the way he had hoped. At last, a successful naturopath. Story 11. I have some stories from a veterinarian's office that might be a bit off topic, but they are quite interesting. First, many people get confused about heartworms and intestinal worms. Heartworms live in the heart, and intestinal worms live in the intestines. Sometimes people think their puppies need heartworm treatment because they see worms in their mess, which is actually normal for puppies. Recently, a woman brought in her dog that had never been on heartworm prevention. We live in the American South where heartworms are spread by mosquitoes, so it's important to have year-round prevention, usually a monthly pill. It wasn't surprising that the dog had heartworms. The woman didn't want to pay for the treatment, which can be very expensive. Months later, she called, upset that her dog had passed, even though she said she followed the vet's advice. Looking at the notes from the appointment, the vet had told her the dog needed treatment or at least a slow method with a monthly pill that isn't very effective, but is better than nothing. It turned out the woman had been buying homeopathic tapeworm medication over the counter because it was cheaper. The most recent story is about a woman who brought in her dog because he had started whizzing in the house. This can happen for many reasons, but for some reason, she wanted a stool test to be done. We told her we could do one if she insisted, but we also needed an analysis to check the whiz problem. She became very upset and didn't understand why a stool exam wouldn't tell us anything about the dog's whiz until the vet looked at her and said, "The stool comes from the bum, the whiz comes from the organ, they're not related." Then she finally got it. The saddest and most stupid thing I've ever seen happened with puppies that didn't survive. An adult man came in with his mom and some puppies that were very sick. They were retching. When not, they cried nonstop. We learned that he had let his two Labradors breed in his backyard to make money from the puppies, but neither the dogs nor the puppies had ever taken precautions. They couldn't afford testing, but the vet thought it looked like distemper and the puppies probably wouldn't live more than a week. He got upset because the last puppies his dogs had got parvo, which at least has a chance of recovery. However, he had been told by someone at a pet store that bleach could remove parvo. I had to leave the room and I still cry when I think about it. He didn't have a disability or anything, and his mom was with him, so she should have known better. It's truly the dumbest thing I've ever seen a patient do, and it's heartbreaking that stupidity can lead to such tragedy. And he tragically misunderstood the pet store lady. Bleach is great for cleaning surfaces that might be contaminated with parvo. It doesn't cure parvo, especially if you ingest it. I'm also sad now too. Story 12. I'm a veterinary technician and I've had some interesting conversations with pet owners. One time, a dog owner told me that his dog wasn't a canine but a pit bull. I tried to explain to him that all dogs are part of the canine family and gave him a simple lesson on how animal classification works and how dogs evolved from wolves. After talking for about 5 minutes about why his dog was indeed a canine, he just said, "No, he's a pit bull though." Then there was a woman who brought in a beagle that was in really bad shape. The dog was so covered in mange that almost all of its fur was gone. The dog smelled really bad. Bad mange has a smell that's like a mix of yeast. The lady insisted that the dog didn't have that, but had been nibbled by a brown recluse spider. I had to tell her that brown recluse spiders don't live in our area and that even if they did, a spider bite wouldn't cause this kind of problem. It was clear the dog had been suffering for months, but she wouldn't accept that it was what it was and kept saying, "He was fine last week when we went away. He must have been nibbled by a spider." Even after the vet and I spent about 30 minutes explaining how it spreads, that it has nothing to do with spiders, and what we needed to do to help the dog, she still said, "I still don't understand how he got all that from a spider bite." Story 13. Interpreter here, and here are some of my favorite stories, as well as those from my friends. A doctor asked a patient if they had chlamydia, and the patient replied, "Nope, Walmart was sold out." Another time, a doctor told the patient they had diabetes and went through the usual education about the condition. The patient seemed to understand everything, but as the patient was leaving, the doctor overheard them telling their friend, "Let's stop and get a big gulp on the way home." The nurse heard this too and made the patient come back for more education about managing diabetes. There was a 60-year-old patient with severe mental health issues who went to the OB-GYN for her yearly visit. The OB-GYN didn't read her chart before entering the room and had no idea the patient had hallucinations. The OB-GYN asked why she was there, and the patient replied, "Well, I'm pregnant." The OB-GYN congratulated her and started the exam. The patient then said, "Be careful not to let my rat babies out of my belly." The OB-GYN was clearly shocked. The patient's escort suggested the doctor read her file. An overweight patient came in for a checkup and mentioned a bad yeast under a skin fold to the doctor. Her husband scolded her and told the doctor it would be fine because he had been putting Bengay on it. The doctor was upset and explained that Bengay wasn't helpful for a yeast. The husband never really understood the difference between Bengay and an antibiotic. One day I was working with a woman who was meeting with a caseworker. They were trying to set up a dentist appointment because her tooth was bothering her. The caseworker asked her to describe the problem. She said, "There's a devil inside my tooth and he keeps knocking on my tooth trying to get out. I need the dentist to pull out my tooth so I can sleep at night, but it's very important that they remove the root first because we can't let that devil escape alive." The caseworker looked at me and asked if she had really said that. I replied, "Yep, trying not to be sarcastic." The caseworker then said, "I don't think it's a dentist we need, honey." Story 14. Optometrist here. Every day, someone comes into my office and tells me that their computer caused their vision problems and now they need glasses to read. No, you're just over 40. Guys, listen and you listen well. Every one of you will need correction for near vision when you are about 40 to 45. Every single one of you. It's called presbyopia, and it's when the once flexible lens inside the eye hardens over time. If you have to take your glasses off to read after 40, then you have the same problem, but you just happen to be nearsighted. You're not superhuman. Stop making me and every eye care professional explain it 50 times a day. You are getting older. And you got to deal with this. Oh, and stop making me explain what astigmatism is, the difference between glaucoma and cataracts, the definition of nearsighted versus farsighted, etc., etc. Please just Google it so I can have a lunch break. Alright, if you guys are enjoying the video and connecting with any of these stories, the one about the Labrador puppies really got to me. Please don't forget to hit that subscribe and like button for more videos just like this. Story 15. I'm not a medical doctor, but I am a veterinarian. Because of my job, I often hear people say things that aren't true about their pet's health. For example, the person who bred my dog told me that my Shih Tzu doesn't need rabies immunization because they are immune to the rabies. You're just trying to get more money from me as a pet owner. I have to correct this by saying that rabies can affect all dog breeds. No dogs are naturally immune to rabies. In fact, it's the law in most counties in the United States and all provinces in Canada that domestic pets must be immunized against rabies. It's frustrating when pet owners don't want to spend about $30 on a required immunity because they've been giving wrong information by their breeder. Another example is, I've been breeding Chinese Shar-Peis for 25 years and every single one has had ear problems. This is a known issue, so all you need to do is give me medication. I won't bring my pet in for an exam because that's just you trying to get more money from me. My veterinary license requires me to have a valid relationship with the pet and owner before I can prescribe medication. If I haven't seen your animal in the last year, I can't just give you a prescription over the phone. Also, the information I learned in vet school shows that dogs with ongoing ear issues often have underlying allergies. My 12 years of medical training and education might be more reliable than your personal experience with one line of dogs that you've been breeding, especially since they all have the same genetics and likely the same tendency towards allergies. Story 16. I have a few stories about patients who didn't always follow the advice they were given. One patient had just been diagnosed with diabetes and we needed to get her sugar levels under control. We spent about 30 minutes talking to her about avoiding sweets and other sugary foods, and she seemed to understand the importance of this, but just 5 minutes after our conversation, she was drinking a soda. Another patient had a condition where his heartbeat was irregular, but it wasn't dangerous. He knew that he might experience these irregular heartbeats from time to time, and as long as he didn't feel faint or have chest pain, he could manage it with a medication called a beta blocker and wait for it to pass. However, he went to the emergency room 6 or 7 times before he finally understood that there wasn't much we could do for him there. One patient came in for a checkup, and when we ran some tests, we discovered that his body's pH level was 6.97. This is extremely low and very close to the point where the body can no longer function properly. In fact, with a pH level that low, he should have been gone, but he was awake and seemed fine. We wanted to admit him to the intensive care unit to carefully adjust his pH level, which was a serious medical condition. However, he insisted on going home because he wanted to eat a shrimp sandwich. We talked to him and his mother for half an hour, explaining that no shrimp sandwich was worth risking his life over, and if there was anything else he needed help with, we were there for him. But he wasn't convinced and left anyway. He came back a few hours later and we were able to treat his condition, but it must have been one very important shrimp sandwich to him. Man, I just wish someone loved me as much as that guy loved his shrimp sandwich. Must have been a good shrimp sandwich. Story 17. I'm not a doctor, but I work as a dental nurse. One of my most memorable experiences was with a woman in her 30s who came in for a checkup at the low-cost emergency clinic where I worked. Her teeth were in terrible shape. She needed a lot of cleaning appointments with a dental hygienist and a procedure called debridement, which is pretty intense and you can find some videos of it online, but maybe don't watch them if you don't like scraping sounds. When we took an x-ray, we saw that she had all her teeth except for her wisdom teeth, and she needed 10 fillings. Some of her teeth could be saved with root canals, but others needed to be pulled out, and we told her that if the root canals didn't work, she might need more extractions. We explained everything and gave her the usual talk about how to take care of her teeth. When we asked if she had any questions, she said, "It's okay if I lose this set of teeth, my others will come through." The dentist and I just kind of stared at each other for a long time, probably longer than we should have. We were speechless. I couldn't think of anything to say in response to that. Hold on, let's not judge a little too early this woman having this ability to grow a new set of adult teeth later in life. Maybe she's 1 in 7 billion humans. Story 18. I'm a dental student and I have a patient who claims to have gone to medical school. Here are some interesting things this patient has said so far. The patient asked me, "Hey doc, do I need to move my head medial or distal?" I replied, "No, just move your head to the right." The patient then mentioned, "Do you remember the Matt Hasselbeck equation from organic chemistry?" This was confusing because Matt Hasselbeck is the former quarterback of the Seattle Seahawks, not a term from organic chemistry. After looking at an x ray that showed a dense object in their jawbone, the patient said, "Doc, this must be a malignant mass because I don't have any lymphadenopathy." Malignant means the cells can spread to other parts of the body, which is bad. However, the mass in the x ray was actually a supernumerary tooth, which is an extra tooth and is considered normal. The patient also requested, "Can you adjust my lingualized occlusion, please? My mesiodistal cusps are fracturing." There's no such thing as a lingualized occlusion, and there are no mesiodistal cusps. The patient was actually experiencing severe bruxism, which is the grinding of teeth. These interactions with the patient were quite unusual, as they seemed to mix up medical terms and sports references in a way that just didn't make sense for dental care. Story 19. I'm a trauma surgeon, and I had a case where the patient was smart, but his parents were not. One night, we received a patient from a car accident involving a car and a pole. The driver was a young adult who was intoxicated and not wearing a seatbelt, and there was a child passenger in the back seat with a 3-point seatbelt on. The young adult was seriously injured, and I admitted him to my service to take him to the operating room right away. The child seemed okay, just a bit stunned, but didn't appear to be hurt. I put a small neck brace on him, recommended a neurological exam for the next morning, and admitted him to the pediatric hospitalist. The young adult did well in the OR, as many young patients do, and I had a quiet night after that. Around 4 a.m., though, I got a call from the pediatric nurse asking me to come back and reevaluate the child. They thought his neurological exam was a bit off. Since we weren't very busy and I knew most of the staff, I quickly walked over to the pediatric building. I met the parents, who were nice but not very observant. They didn't think anything was wrong with their son. I woke the sleepy child up to examine him, and something became clear that wasn't obvious in the noisy trauma bay. He wasn't responding to instructions. He was smart and could figure out what I wanted him to do, but without gestures or other cues, he didn't follow any instructions. I did a quick hearing test, and he didn't respond at all. I thought I might have missed a serious injury if he was deaf in both ears. I looked into his ears with an otoscope, and his eardrums were perfect. This was strange, I thought. The parents watched my growing concern with blank faces. I asked if their son was deaf, and the father said, "No, he's just a little funny." As I asked for more details, I learned that the child had never spoken a word in his life and never responded when called from another room. I called the child's grandmother, and she confirmed what the parents had said. It turned out the child was born with a rare form of congenital hearing loss, but his parents never realized it and had never taken him for regular checkups. The specialists were not very helpful that he would ever learn to speak, and he was far behind in learning sign language, with the risk he might never become fully proficient. I was so frustrated that I almost cried. I stayed after my shift to follow up on his audiology exam, but the situation was very sad and challenging. Story 20. I'm not a doctor, but I work in a doctor's office as a medical office assistant, specifically in pediatrics. One day, a secretary buzzed me to let me know there was a call on line 2 from someone needing medical advice. I picked up the phone and found one of our patient's mothers on the line, panicking. She was hyperventilating into the phone. I asked her if she was all right, wondering if she needed an ambulance. Through her breaths and now tears, she started telling me that she thought her son had a fracture. I asked if he had fallen. She said no. I asked if he was conscious. She said yes. I asked if he was breathing. She said yes. And I asked if there was any visible wound. She said no. I asked why she thought he had a fracture. She said it was because the area under his eyes was red and puffy, and according to Google, that was a sign of a fracture. I told her to go to the emergency room for a proper assessment, as her office doesn't have the equipment for MRIs, X-rays, or CT scans. She didn't want to go. She said she was supposed to take her kids to the beach. Keep in mind, she was still crying and breathing heavily at this point. I told her to come to our office right away, but I warned her that we would probably have to send her to the ER. She showed up 15 minutes later, cradling the child and crying. The little boy was crying too and screaming, "I don't want to be gone, Mommy." She kept trying to calm him down, saying, "Mommy loves her strong boy no matter what." But this only made him cry harder. I took her and the child into her room and listened as she told me how she had looked at him in horror that morning and seen these sure signs of a fracture. She was convinced he must have hurt his head the day before during swim practice. The little boy was crying hard, but I could see the swelling and pinkness under his eyes that she had mentioned. I went to the doctor and shared my thoughts. The doctor went in to examine the child and came out about 10 minutes later, shaking her head. She had reached the same conclusion as me. It turned out that when the boy wiped his eyes after swimming the day before, he must have also wiped off the sunscreen around his eyes. All the pinkness and puffiness were from a mild sunburn under his eyes, not a fracture. Story 21. I had a patient who came back for a checkup after having lap band surgery. What we usually do during these checkups is to review the patient's weight and make adjustments to the band, either tightening or loosening it as needed. It's important to remember that getting lap band surgery isn't just a matter of paying for the procedure. Before the surgery, the patient has to meet with a psychiatrist and a dietitian for 6 months. This is to make sure they understand what they're getting into and to see if they can change their lifestyle and commit to the process. The patient is also usually given a goal to lose a certain amount of weight, like 10 pounds, by the end of the 6 months to show they're serious about the surgery. After all this careful evaluation, a patient is considered ready for the operation. Then there was my patient, Sylvia. I looked at her chart and saw that before the surgery, her BMI was 40, which meant she was morbidly obese. Now she had come in for her first follow-up to see if she had lost any weight. I put her on the scale, did the calculations, and was surprised to see that her BMI was now 45. I was puzzled and asked her to tell me about her diet. Sylvia said, "Well, I've been on a liquid diet, just like you all said." I replied, "That's good. Can you tell me what you've been having?" Sylvia said, "I make smoothies and drink them whenever I feel hungry." I asked, "So what do you put in your smoothies?" Sylvia said, "Cake and ice cream." I was speechless. She was completely serious. Somehow it didn't occur to her that this wasn't a healthy choice. We had to reverse her lap band surgery. Story 22. A patient came to the clinic with a rash around her mouth. She talked about how she had a similar rash 14 years ago and a dermatologist had given her a specific antibiotic to treat it. She also said she was diagnosed with perioral dermatitis back then. She showed us pictures she found on Google to illustrate what she was talking about. The doctor examined her and decided she actually had impetigo, which is a different skin condition. The doctor prescribed an antibiotic ointment to treat the impetigo. The patient left the clinic, filled her prescription, and then came back very upset. She had looked up impetigo on Google and, based on what she had read on WebMD, she believed it was a condition that only children get, affecting their arms and legs, and it could only be caught from children. She insisted she hadn't been around any children and therefore couldn't have impetigo. She was convinced she had perioral dermatitis, which she thought was a condition only women could get and not this children's disease of impetigo. She also said that the antibiotic the doctor prescribed wasn't listed as a treatment for perioral dermatitis according to her internet research. During this time, she kept showing us pictures from Google of perioral dermatitis, claiming it was a woman's disorder. However, many of the pictures were actually of men. It's important to understand that perioral dermatitis simply means a rash around the mouth. It's not a specific type of rash, and it's not treated with only one kind of antibiotic. It's just a rash that happens to be around the mouth. The patient was extremely angry and started shaking with rage. She was so upset that she was almost ready to start something because the doctor wouldn't give her the specific antibiotic she wanted. The doctor told us to call the police if she came back to the clinic. It's situations like these that just show how some people can become unreasonably upset and difficult to deal with. Story 23. I work as a receptionist and office assistant at a large clinic. So I'm not a doctor, but I interact with a lot of patients. I haven't been doing this job for very long, but there are a few interactions that stand out in my mind. One time, a woman came calling asking if our clinic could perform a V-card test on her because her primary care physician had told her they didn't do that. It took me a while to explain to her that such a test isn't real. Another time, a woman came in needing to get tested for STD, which isn't unusual. However, she said she needed us to send the results to her potential employer. I was puzzled as to why an employer would want STD test results. We told her we wouldn't send the results directly, but she could come and get a copy of her results and do whatever she wanted with them. She did come to get her results, but later that same day, she returned and said we had given her the wrong test results. We double-checked, and no, those were definitely her test results. As we tried to sort this out with her, I asked why her employer would want an STD test anyway. She said it was to make sure she didn't have tubulars. Then it clicked for me. She meant tuberculosis. She needed a TB test, not an STD test. She got angry and accused us of trying to trick her into taking more tests so we could charge her more money. Then she stormed out of the clinic. It was a confusing and frustrating situation for everyone involved. Story 24. Physiotherapist here, so close enough. I've had quite a few rather interesting patients, but one in particular still stands out. I was in my final year of uni on my musculoskeletal rotation working in a hospital outpatient clinics. I'd read the file for the patient I was about to see, and there were a few yellow flags, but nothing bad enough to prevent me from treating him. Anyway, I called the guy's name in the waiting room and was greeted with one of the oddest looking people I've ever seen. Anyway, this guy comes in and I start going through my subjective with him. He's got a neck injury, but he's pretty vague on exactly what happened. Halfway through my subjective, he stops me and asks, "Did you hear the moon last night?" I asked him to repeat what he'd said again, assuming that I'd misheard him. "Nope." "Did you hear the moon last night?" I replied that I hadn't. He proceeded to tell me about how the moon had previously told him to cause the fairly recent Christchurch earthquakes, and that it wanted him to do it again, but he wasn't sure because it hadn't gone over all that well last time. I managed to move past that and got into my objective. He had some restricted range in his upper cervical spine and complained of some grinding, which was consistent with his older x-rays. Basically, fairly significant degenerative changes to his upper CX spine. I showed him a few exercises and stretches to be done, which he was fine with, but he kept insisting that I manipulate his neck. At the time, I wasn't really up to manipulating anyone's neck as a physio student, but I certainly wasn't going to be doing it to someone who was convinced that the moon was talking to them into creating natural disasters. Eventually, he started getting a little agitated with my refusal, and when I refused again, he replied, "You can't stop me, I'm too powerful." He kept repeating this every time I refused. At that point, my supervisor finally decided to intervene and basically sent him away. I've still never had a stranger patient, and I never did figure out how his being too powerful was supposed to lead into my inability to refuse to manipulate his neck. Story 25. Had a patient that superglued a crown back on tooth number 10. He wasn't a usual patient, but his dentist wasn't open that day. He didn't even get close to down all of the way, so this crown was keeping him from closing. He got mad at me when I told him not to use superglue. He said, "Okay, smart guy, what should I use to put a crown back on?" He was giving me the smuggest I can't close all the way smile he could. And one of the rare times I got a retort out with good timing, I replied, "A dentist." My assistant ran out of the room and I could hear her completely losing it laughing down the hallway. The patient wanted me to fix it, which was to take off the crown and make a new one. I asked him what his medical history was. He already signed one he filled out, but I always ask because people leave stuff off, and specifically asked about heart procedures. He said he just got out of the hospital 2 days before from having 4 stents placed after a major heart emergency. When I asked him why he didn't put that on his medical history form, he said, "You're a dentist. You don't need to know that." I told him I need a medical release for treatment from his cardiologist and I would not do anything until I had one. He seemed not to understand that his mouth is attached to the rest of his body. He was pretty mad I wouldn't do what he wanted, but I didn't want to call for an ambulance that day. Story 26. I work at a pain clinic and we had a lady come in with chronic pain. We suggested steroids as a possible treatment, but she was very against it because her family member had a bad experience with these. We went over other options, but she objected to each one. We suggested a referral to an orthopedic surgeon, but she was completely against having another surgery. We talked about physical therapy, but she said, "I've done that before and it just made my pain worse. I won't consider it." Finally, we brought up medications, but she said, "No way, I'm not a pill pusher. I won't take any meds." She was really upset at the end of the appointment, saying we didn't care about her or want to help her. I was confused by this encounter because it seemed like she was expecting us to wave a magic wand and make her pain go away instantly. But then again, I wouldn't be surprised if she didn't believe in magic wands and wasn't willing to give them a try either. It was a challenging situation where it felt like she wanted relief but wasn't open to any of the standard treatments we offered. And if you like these stories, here's more for you. YouTube thinks you're going to love this. I'll catch you in that video, and thanks for hanging with me on this one.